There we go. Good morning, everyone, and welcome to episode 5 of Add Water and Stir. This morning,
5?
Yeah, 5.
Okay.
This morning we are going to be talking about having the money conversation and insurance with your patients. That is such a perceived roadblock for a lot of practices, and we swear it's easier than you think.
It really is, and we've talked before. We've kind of led you through this journey of identifying your patients who have obstructive sleep apnea, talking about the consequences of untreated obstructive sleep apnea. One thing I may not have brought up that I did want to point out is that poor quality sleep or lack of sleep actually increases inflammation within the body. A lot of people don't know that, but there are many studies out there that indicate that inflammatory cytokines are increased in the bloodstream in insomniacs or sleep-deprived individuals. So, our health is important, and sleep is a vital part of that. So, we've taken you down the journey, and we've identified our patients. We've shown you how to do an examination, and now it's time to talk about moving forward with treatment. Clearly, when you've reached the stage of completing your examination, gone over sleep studies, etc., you have a patient who's sitting there, who came to you for a reason and really wants to move forward with treatment. Now, obviously, you as the dentist in your practice, you need to be paid. Now, medical insurance, both PPO and Medicare, do cover treatment for obstructive sleep apnea. In our practice, average case will bring in approximately $3,000. That would be during the entire first year follow-up, etc., with a laboratory bill that may range from the $400 to $600 range for a high-end appliance. And I'm an advocate of using high-end appliances. They last longer. There's just less hassle. You don't have to see your patients for adjustments and things of that sort. So, now we're at the point where it's time to talk about how we're going to proceed forward. Number one, you need to make sure that you have the proper documentation, right?
Absolutely.
Okay, so what is that documentation? Well, valid sleep study, okay?
Good start.
An examination, and a physician prescription for the appliance. It doesn't have to be the physician that interpreted the sleep study. It could be the patient's primary care physician, but you do need a physician prescription. Many of the sleep studies also will come with a built-in prescription when it lists the treatment options, and that can serve as a prescription. But I'd like you to take it one step further and involve the patient's, at least the primary care physician, if not a sleep physician that they may have seen. So, once you've got that, then it's a matter of moving forward with treatment. And, my script goes something like this. Mr. Jones, we've examined you, we've gone over your sleep study, you haven't been able to use a CPAP, and you've got moderate obstructive sleep apnea, which you've told me is disturbing your sleep and your wife's sleep. Sometimes you're even sleeping in the other room. You're a good candidate for an oral appliance. I'd say you're a great candidate. I mean, did you know that, and I think I told you, that oral appliances will reduce your loud snoring 90%, and I anticipate that you'll have good results with that. So, we want to be able to move forward with this. So, we have to have this conversation about how the money's going to work. We're going to bill your medical insurance for this. We will be billing it at $7,500, let's say. As you can imagine, these are very expensive devices to make. They're one of a kind, unique, and as such, we're going to ask you for a down payment. In our office, the down payment is $2,900. And what we'll do is we will take care of all the billing of your medical insurance we've got a terrific medical biller, and we will reimburse you every penny we get up to $2,900. Would you like to move forward? And that's basically the conversation that we have. As a matter of fact, we actually get the records because we do them digitally before we have this conversation, so that we're ready to go, because there can be a variety of responses that take place after something like this.
Absolutely.
And we call these what? Plan
A, Plan B, and Plan C to get your money.
Right, exactly. So, what is Plan A? Well, Plan A would be that Mr. Jones says, I'm ready to go. I'd like you to bill my insurance and get back just as much as you can for me. Let's get started. Here's my credit card. That would be a Plan A patient. So now you're taking the money, and you'll move forward with treatment. You'll get the medical billing underway, et cetera, et cetera. A plan, and then there's also like a Plan A1, I'm going to call it. And Plan A1 would be like Mr. Jones says, oh yeah, sure, I want to do this. Here's my credit card, but can you find out a little more about, give me a better idea that my insurance is going to cover. So on that patient, we'll take the money, and we will then submit the documentation to our medical biller, who will submit to the insurance for what's called a predetermination of benefit.
Right. Typically, your medical biller will know if that is required. Excuse me, I was talking about a pre-authorization.
Right.
I interrupted. I'm so sorry.
That's okay. In dentistry, we kind of use the term predetermination and pre-authorization interchangeably, but in medicine, it's different. Predetermination, all it does is it determines what the level of, if there's coverage, okay, and what's going on with the patient's deductible, in-network versus out-of-network benefits, and if this sort of thing is covered, and if so, at what percent. That would be a predetermination of benefit, right?
Absolutely.
Now, let's say Mr. Jones's insurance also required a pre-authorization of a pre-authorization. Now, a pre-authorization is a determination of medical benefit. Okay, so the documentation gets provided to the insurance company, and the insurance company reviews the documentation and then comes back with a letter of medical necessity saying that yes, it is indeed covered. So that would be a pre-authorization. So on this Plan 1A patient, then we would at least get the predetermination of benefit, and if necessary, the pre-authorization, so that we can call Mr. Jones back and say, yeah, it looks like you've got good good coverage. Your deductible for the year has been met. You'll be covered at 80%, and we'll do pretty well for you. So we're going to move forward. So that would be that A1 patient that we were talking about.
Yes.
Okay. Sometimes these A1 patients also want to know, exactly what they're going to be sure that they're going to get their money back. And that's why I advocate getting the records before we have the conversation. Because once you've got the records, then you can bill. I mean, with all of our practices, almost all of them, when we do crowns, things like that, we're typically billing insurance at the prep appointment, not at the seat. And so in this case, you've already got your records, your bite registration, your exam, etc. You've got everything. So you would go ahead and bill for the device. And once you know that you're going to be paid exactly how much, or sometimes that the money actually comes in, then you call Mr. Jones with the good news, and you get to move forward. We also tell our patients that are in this category that if we find out that your insurance is going to another technical difficulty. So what I was saying is that if we tell our patients that, look, we're going to bill you, we're going to proceed with your medical billing, but if we find out that you're not going to get real great coverage, we'll tell you about it. And if you decide you don't want to move forward after all, then we will refund you. So we try to make it real easy for people to move forward.
Right.
Okay. So Plan B would be a patient who says, "Do I have to pay you now?" Okay.
Right. Or do I have to pay you all of that right now?
Well, and so that answer with our Plan B patient would be, no, you don't have to give us anything right now. We can get you financed, and then we'll use something like Care Credit or Lending Point or one of the other financing companies, so that they can get maybe 12 months interest-free, okay? And we tell them, look, you don't have to pay us anything. We can get it financed. You'll have 12 months to pay it back, and that your insurance would pay way before that time is up. Okay.
Exactly.
So that would be a plan B. And then we have the plan C. And the plan C kind of segues into that, that patient that I said was an A1. In a plan C, it's a patient who is not going to be able to give you the full $2,900.
Right.
So that could be less than $2,900, and that could include zero, right?
Yes.
Okay.
That is less than $2,900.
Yes, exactly. So what do you do in those cases? Well, the same thing that we would do with the A1. We would tell our patient, look, we've already gotten our secured the beginning records. We can bill for this, so we're going to bill your insurance for this. Once we find out that they're paying exactly how much, or if we receive a check, we'll call you with the good news, and then we'll move forward. Okay. Now, those are the three scenarios, and I think that if you practice these scenarios, we can help you to practice that, help you with your team to put all of this into place. Once you've done it a few times, it's pretty simple, and then you can be really off to the races with treating and getting paid nicely for your sleep apnea. I mean, it's great to have that supplement. I mean, we tend to see, I try to keep it to about one sleep apnea new patient per day. In my practice, we're working about 10 days per month in the practice. So as you can see, that's like 10 patients that are coming in, and probably 3/4 of them will give us a down payment. So that's a pretty good amount of money. I mean,
Yep.
So we're talking like 7 times $3,000. So that's $21,000 of income that just sort of happens. Okay, I'm doing my other thing, my restorative dentistry, my implant, whatever I'm doing, or if I'm not particularly busy, well, then we're still going to get some nice money from these patients as well. So we also want to make sure that when we do call back a patient who has given us that down payment, and we tell them, look, your insurance, we don't think we're going to be able to maybe get you more than about half of that back, then what do you say to them? Well, you do tell them that $2,900 that they've paid, that you're not going to ask for more. In fact, I just had a conversation with a patient a couple of days ago. Okay, now he's also become a dental patient. We saw him in the practice with our hygienist Tuesday. Okay, type of patients who was wondering, how much am I going to get back? But he was also very anxious to get the appliance. Okay, he wasn't sleeping well. It was disturbing his wife. It was a real problem for him. And so, he asked me, well, if my insurance doesn't pay, how much more is this going to cost me? And that's why you want to get a down payment that's equal to your cash price. Okay.
Right.
So I was able to tell him, hey, look, Adam, we're not going to have to ask you for any more money. The amount of money that you paid us actually covers all of your visits, manufacturing the device, delivering it, and all the follow-up for the first year. So you don't have to worry about having to pay any more. And he said, well, in that case, I want to move forward. So because he wanted his appliance, and it was like, how soon can you get it to me? He did delay things about a week or so while he was kind of hemming and hawing about whether he wanted to move forward, because we obviously couldn't tell him exactly what his insurance was going to pay. So know that this is a treatment that people really, really value and want. Okay, and you have to set up your office accordingly. We're here to help you to do that. So Nikki, why don't you tell them how we can help?
Well, quick tip, when you are building your financial policy for dental sleep medicine, there's some key aspects that Dr. Greenman said when he was presenting the policy to the patient, and something that I always encourage offices to add, first and foremost, the amount of money that's expected, of course. Second, your policy for reimbursement when and if insurance pays. And the third one I always like to see included is an explanation of what we're making, because you're not making these patients some rinky-dink little suck-down piece of plastic. You're making them durable medical equipment, which is custom-made just for them, is designed to last years, and can change, if not save, their life. So you really want to add value to the item that you're making for them, so that when you do maybe have to go back and explain what insurance is doing, paying now, paying later, that they really see the value in what they are about to put their credit cards down for. I think that makes the future conversations a little bit easier.
Exactly. I mean, you want, somebody's not going to, if somebody says to me, look, I'm paying $2,900 for this, and then we may have an example of a device, I'm paying $2,900 for this. And, my answer is no, you're paying $2,900 for us to determine how to manufacture it, the manufacturing, and the follow-up during the first year. And it's actually a good deal.
Right.
And, when I tell them that, then, okay, well, we'll move forward. So
some ways that we would be able to help your office is by building that script with you, making sure that you have all the key parts in place, getting your team locked and loaded with all of your policies in place, because they're the ones honestly presenting the financials much more frequently than doctor. Like Dr. Greenman said, he's busy with his restorative cosmetic cases. It's Lisa who is the one sitting the patient down and kind of outlining what's expected physically, what's expected financially, and what the plan is. So we'll help get everyone comfortable with putting that out there. We will also get you set up with a third-party medical biller.
Yeah,
important. That's very important. That's a really key piece to making this work in your practice. You guys are already doing enough. Your team's already doing enough. Dental insurance and medical insurance, it's like English and Russian, two different alphabets. You don't need to learn a whole new language to make this happen. Let's let the professionals take care of it. And we have an army of very qualified medical billers specializing in DME that would be able to help you out.
Very good.
Yeah.
All right. So what about next time?
So, let's talk a little bit about a little bit about insurance. I think a lot of offices get nervous with medical insurance because they don't know what's going to be paid to them, especially when they're out of network, which most offices are. What I want to say is the first few cases are definitely a live and you learn. That is, again, what we are here to help you out with, holding your hand through those first few cases, seeing that first predetermination. It can be a little bit like reading tea leaves. I always like to say it's like a red light, green light. You're not going to know exactly how fast you're going to be going, but you're going to be on the move, and we will help you determine what that is going to look like. And then the good news is, as you start to do more and more cases, prime that sleep apnea pump, you'll start seeing that cash flow, and you'll really learn what insurances in your area work. If you're in an area with a particular large company and after taking care of a couple patients that so-and-so Incorporated has a Cadillac health plan, you're going to be able to give patients maybe some more assurances moving forward, give them a little more information. But the key is to really have your financial policies in place and a qualified medical biller on your side.
Yeah, here. I've been working with the same medical biller for over 10 years, and it's pretty seamless. And the other thing is that when you get requests or anything back from the insurance company, your team has to know that all they really need to do is forward that on to their medical biller, who will take care of everything, and just remind them that that's what the medical biller gets paid for. Our medical biller gets paid a percentage. She gets 9% of what we collect, which means that she's incentivized to collect as much as possible, and that means benefit for our patient.
And don't be scared off by horror stories. Having a good financial policy, having a down payment in place, making sure that the finances are cared for on your side is going to make the whole process a lot smoother.
Yeah.
Really.
Yeah. So we're here to help you with the moving parts. The clinical side is pretty darn easy.
Yeah.
I think what a lot of our client offices and a lot of practitioners find is it's the the systems part, including the financials and the medical insurance, that gets them bogged down. But it's really not that hard. And we're here to help. We'll help you with looking at predeterminations so that you know what they are. I'll help the doctor with their presentation, with their consultation, including money conversations, because it's going to start. Doctors are going to have to do that to begin with so that they can get comfortable with it, so that their teams then can take over, take the ball, and keep things running.
So I think for next month, what we should talk about is maybe some direct-to-consumer marketing. A lot of the in-person plans have been hobbled a little bit, but I think that there's some good digital, online, direct-to-consumer marketing that every office can start to do internally and externally to start attracting some patients, some CPAP failure patients, maybe some patients that have been avoiding sleep apnea, getting tested because they don't want to have to wear a CPAP, and getting some new butts and chairs that, like Dr. Greenman mentioned his patient earlier, you can even convert to dental patients.
Hear, hear.
Okay,
well, thank you.
Per usual, please don't be shy watching this live this morning, watching it at a later date. If you have questions about setting up the financial policy in your practice, getting everything in play, please reach out to us. Email info@dentalsleepapneatraining.com. Facebook at DSM Solutions CA, or excuse me, that would be Instagram at DSM Solutions CA, Facebook at DSM Solutions, or give us a good old-fashioned phone call, 818-561-6715.
Very good.
All right, see y'all next month.
Bye, everybody.
Bye.